is David Quinzi. I'm an orthopedic surgeon specializing in total joints. My schooling and medical training started at Cornell University for undergrad. I did my medical school at Upstate Medical University in Syracuse, went back to Rochester and studied at the University of Rochester for residency, and then I finished up my fellowship in adult reconstruction down at Rothman in South Jersey. I like fixing problems in medicine and I like quality of life, and I think joint replacement is the perfect mix of both, because you take someone who has a worn out joint and probably not doing the things they like to do, and you have a good fix for it that lasts a long time. So that kind of drew me down that pathway. I think medicine can be very robotic and mechanical, so I try to be the complete opposite of that. I like to hear a patient's story, why they're in the office today, what's led them to me, and then I'll find out ways I can help and fix that. What type of joint conditions do I treat? In a more general sense, I'd say wear and tear of the hip or knee joint. Now, whether that's from just osteoarthritis or post-traumatic reasons. I also take care of AVN of the hip or knee, and then issues that might arise from previously replaced joints, such as fractures around the implant, wear and tear or loosening of the implant, or other reasons why it might go awry. Physical therapy, I think, is extremely important. Caring for these patients is a team job, and especially with knee replacements, you really gotta put in the effort with PT to get a good result. I think that tracking outcomes research is very important, and using that outcomes research to benefit the patient in the long term and see where we can improve, I think is very important. What does it mean to me to join a large group of fellowship-trained joint replacement surgeons? I think it's extremely valuable, especially as a new surgeon, to have that much expertise and life experience. It's very beneficial to the patients, because if any difficult cases come up or any questions in general, just getting started, we can confer as a group and find the best course of action, which I think really does improve patient care. So candidacy for outpatient joint replacement, I think, kind of relies on three things. For one, the patient has to be motivated to do an outpatient surgery. Secondly, I'd say they need to have an environment to recover that's appropriate for that. You can't have 30 stairs winding up. And then finally, they have to have no pre-existing health conditions that would preclude doing outpatient surgery in an unsafe manner. With regards to unique procedures, I perform direct anterior approach total hip replacement for primary and some revision surgery. And then I will be utilizing robotics to assist in some knee replacement procedures as well. Even just in medical school, I knew of SOS training at Upstate, which is right down the road. I didn't really get a chance to work with the guys until my 4th year of residency, where I actually did a week, and I got to see the skill and the efficiency and how these people treated patients. And since that time, I always had it in the back of my head that I wanted to end up back here, growing up in upstate New York and being able to take care of this patient population, and I guess the stars aligned and it all worked out. I love Central New York. It's where I grew up. It's where I learned to ski. I played a bunch of sports here. I love being outdoors, and it's a place that I want to be. Do I have any hobbies? Yes, so lots of outdoor stuff. I love being on the water. My family has a place up in the Thousand Islands, so we go up there pretty frequently. I love to golf. I love to ski. We go out west every year and try to catch some powder, because the snow out here is a little icy. And then just being active, working out, staying active, and then family time.